Welcome everyone to this conversation today. We have some really great guests. My name is Sabrina Baggio, and I work for Groundwork Lawrence and We Are Lawrence. We Are Lawrence is a citywide resource guide and community calendar. And I also have my co-host here with me, Eddie Rosa, but I'll allow him to introduce himself.
Hey everyone, my name is Eddie Rose. I'm the Community Engagement Director for Groundwork Lawrence and a Lawrence resident. And we'll move it on to the important folks here who are going to be joining us.
So my name is Dr. Lance Braye. I'm a third-year resident at the Greater Lawrence Family Health Center, along with a colleague here, and where we both practice in the health center and also in Lawrence General Hospital.
And my name is Dr. Julia Cooper. I'm a fourth-year resident, and I'm very happy to be here.
Awesome. Thank you very much for joining us today. Obviously, this is a very important conversation that we hope will be helpful to folks as we are now in our winter months. We are continuing the holiday season beyond Thanksgiving, and just wanted to talk about how people can be more safe moving forward as things get tougher. So thanks again. I'm happy to jump in on our first question, which if you can help us picture what would, in during COVID, during this pandemic, what is really the definition of the perfect world versus reality scenario right now?
Yeah, so I'll go ahead and answer that. So I think the big thing is, with everything that we've talked about with coronavirus or COVID and how to prevent it, staying at home, wearing masks, everyone staying socially distanced, that all can totally happen if we lived in a perfect world. And by a perfect world, I mean every city is just as healthy as the other. Everyone is just as wealthy as the other. So everyone has a job where they could stay at home without having to worry about keeping the lights on. It would also mean that everyone had a job that they could stay home. That doesn't necessarily keep the country moving, like being an essential worker. And it would also mean that everyone was equally healthy. So you don't have to worry about, what we are calling high risk individuals, like those with diabetes or high blood pressure or lung disease, from getting coronavirus. But unfortunately, that's just not the reality that we have. And especially when you look here at the city of Lawrence and why our rates have been so high, it's because we have kind of the opposite of all those things that I just listed out. When it comes to just housing in general, we are a lot of people squared into like 6 or 7 square miles. So we have a lot of crowded housing, which makes it really hard to isolate yourself whenever someone's been sick, or to quarantine yourself if you got exposed at work or just out in the city. A lot of us here in Lawrence, we also work those essential jobs. We're nurses, we're MAs, we're PCAs, we're factory workers, we're grocery store workers. If we don't go to work, nothing gets done really. So we don't really have that luxury of staying home. And then, just because of racial health disparities in this country, when you look at a Latinx community like Lawrence, we're going to have higher rates of diabetes and hypertension and all those illnesses that make you high risk. And that's just not just Latinx folks, but our African American residents as well, and anyone else who's a minority, because unfortunately we do not have equal health outcomes in America.
Understood. Thank you for that.
What are the top tips you can give to prevent the spread of novel coronavirus?
Yeah, so coronavirus unfortunately spreads really easily, especially through what we call respiratory droplets. Respiratory droplets are basically, it's gross, but tiny, tiny little globs of spit that are generated when you talk or when you sneeze or cough, or even a little bit when you're just walking around breathing. And so this is the reason that the biggest difference that we've been able to make has been implementing mask wearing. And the most important thing you can do is wear a mask covering your mouth and your nose. But, there are other things that are really important too. Obviously, even with a mask, it's important to stay separated from people by about 6 feet if you're able to, because that's a bigger distance than most respiratory droplets can cross. And then it's important to wash your hands frequently. I always tell people, washing your hands with soap and water is the best thing. Hand sanitizer is great, but it can be kind of hard on your skin. And then especially after you've been touching things like touching doorknobs or touching other objects or touching the outside of your mask that's been exposed to the air, it's important to wash your hands before you touch anything else. I also think a lot of people prefer to use gloves. And I always tell people, you don't actually have to waste your money on gloves. Hand washing is just as good as wearing gloves. And if you are going to wear gloves, it's important to use them just for a short period of time. Because if you're wearing the same pair of gloves all day long and touching things and then touching other things, you're just spreading germs. I also wanted to talk a little bit about the different types of masks that are available, because a lot of people prefer the little paper masks like we use in the hospital, which are actually plastic. But the disposable masks are great. They work just as well, but they shouldn't be used over and over again. They're meant for like one shift or one trip to the grocery store. If you're using a fabric mask, you should wash it at the end of each day. You shouldn't hang up your fabric mask on Monday and then put it back on your face on Tuesday. And then I also wanted to talk a little bit about other activities that are high risk. There are certain things like singing in a choir or smoking hookah with your friends that involve exhaling a lot of respiratory droplets into the air and are pretty high risk activities. So none of us should be smoking hookah or singing or getting together in an enclosed space and shouting or things like that right now. Another thing that's really important is keeping your household isolated from other households. So, in a perfect world, you would want to wear your mask and stay separated from everybody, including your family. But it's just really hard to separate that way from people that you live with. So we tend to make an exception for people who live together. Like, for example, I work in the hospital and I work in the clinic. I probably come home with germs sometimes, but my husband and I decided that I don't need to move out of the apartment for the rest of the pandemic, which was very nice of him. And it means that I'm going to expose him, hopefully not, but possibly, to some germs. But anybody outside our household, even if they're very close friends, even if they're our brothers or our mothers or other relatives that live nearby, could come and get exposed too. And so even if people are close family, you really want to keep them out of the house if they don't already live with you.
Right. That's a good point. Thinking of it in terms of a household unit, because as we have seen with holidays, people are having family over, but family can include people that live in your household and outside your household. And we're trying to reduce having people over or going to other people's houses. So with that, can you help explain? I know during a good portion of the pandemic, especially early on, the whole pandemic and the kind of recommendation to stay at home had been labeled like quarantine, but it's not exactly that. So can you help us understand quarantine, but then also defining isolation and when those two terms are being used?
Sure. All right. So we'll talk about quarantine first, since that's the most popular of the two. So quarantine is basically when you take someone that is healthy, like any of us on this call right now, we're totally fine. We don't have symptoms. But let's say we got exposed to someone at work, or we were, or a friend that we saw said, hey, man, I got COVID. So then we would have to quarantine, which is basically when you just separate yourself from everyone for 2 weeks to see if you are going to get sick or develop symptoms. Some other people also quarantine in the sense that, let's say they just have to travel for work and they can't get out of it. If they want to make sure they're not going to be taking coronavirus across the country, they say, okay, for the next 2 weeks, I'm just going to sit at home and not leave the house and make sure I'm not sick. That way, when I get on that plane, I know for sure that I don't have coronavirus and I'm not spreading it. So that's quarantine. Healthy people waiting 2 weeks to see if they're actually going to get sick. Isolation, on the other hand, is when you're already sick, like coughing up a storm, you tested positive, there's no debate, you got COVID. And that's when you just stay to yourself, stay at home, in order not to spread the virus to anyone else. So, early in the pandemic, we were telling people, you just stay in your room and have family, bring food to the door or something like that. And then a third thing being the stay at home orders. So that's kind of different from the two, right? Because quarantine is when you're healthy and you got exposed and you're trying to make sure you don't get sick. Isolation is when you're sick and you just don't want to get anyone else sick. And the order to stay at home is just for people not to mix as much as possible to keep folks from spreading that virus, right? Because again, we don't live in a perfect world. And I think we can all acknowledge it's really hard to just sit in your house or apartment for 2 weeks and not do anything. So when you have the stay at home order, that keeps everyone safe by nobody mixing in unnecessarily when they don't have to.
Awesome. So thank you, Dr. Braye. Now, can you help us understand, so if someone does test positive, and we're looking at the household, not, is the household, friends, family, whatever the mix is, specifically who you live with, if someone tests positive, now does the whole household need to isolate or quarantine?
Yeah, they do. Because again, like Dr. Cooper was saying, in a perfect world, we'd all be masked up, even when you're talking to your husband, your wife, your kids, but we just can't make that happen, right? So if somebody's in the house with you that you live with and they are sick, you've basically been in a box with that person as they were just putting virus into the air and you were breathing in that same air. So you've been exposed and you're at risk. So everyone in the house, and again, Sabrina, like you said, being the people that actually live in that apartment or that house with you, needs to quarantine or isolate. And again, if the sick person is going to isolate, everyone that just lives with them but is not sick, they need to quarantine because we need to see if they're going to develop symptoms over the next 2 weeks. And why is that so important? I'll reiterate again, is because we see that people can actually spread the virus for a day or two before they actually start to have symptoms. So you just can't wait and say that, oh, no, I'm fine because I'm not coughing, because you may have been spreading it for about a day or two before then.
Mm-hmm. And then I guess a little bit just to reinforce what and readjust people's idea of what the definition of quarantine or isolating is. Can we just reinforce that it includes not going to do errands, not going grocery shopping, stuff like that? Like, even though you're not interacting with people that like, it's still a risk. Just even passing in the aisle at the grocery store, like, can we help people, I guess, hunker down a little bit?
Yeah. So exactly like you're saying, quarantining means like you're not leaving and you're not mixing in with anyone. Even if you are quarantining, you say, okay, well, like, I'm not going to go to the grocery store, but I'm gonna have my friend come over, like, to drop me off some pizza, and we're going to sit and eat pizza for a bit. Don't do that, because now your friend is sitting there across from the table from you eating pizza, probably getting exposed. Or again, you can't say, oh, well, I'm just going to Market Basket, or I'm going to the bodega on the corner. It's fine. It's a quick trip. I'll be back. Because no, if you have the virus in you and you're spreading that virus out, none of these masks are like foolproof, totally airtight to your face where you can't say that you probably can't affect other people. And then another big thing, like I said, or even if it's something like going to the pharmacy, again, you can have people drop off medicines to you. The big thing is really just planning, but you don't need to be exposing yourself to other people. Ask others to help out for you.
Cool. So with that in mind, not being able to do errands and such, what if someone wants to take a break, take a walk around their block? They have their mask on. They're like, oh, I don't see anyone on the street. Like, can they still go out and take a walk, not knowing if someone's going to pop around the corner? Obviously, there's stuff that you can't predict, can't control. Like, what do you say in those cases?
Yeah, I would say if you're quarantining and especially if you're isolating, don't take that risk because again, like you said, you just don't know what you're going to encounter out there, right? Like if you knew for sure that you were going to go outside in the middle of the city of Lawrence and not encounter a single other human being, then maybe go for it. But none of us can guarantee that, right? Like you walk 5 feet here and you're going to run into at least three people. So don't take that risk. Because again, if you're still spreading the virus, if that person just happens to walk by you and you get within that 6 foot radius for a little bit, you're still putting them at risk.
Yeah. And I would say that it's a little bit different if you're just trying to be generally cautious and following the stay at home recommendations. Like if you're not under quarantine for a specific 2 weeks because you need to know that you're negative so that you can go visit somebody, but you're just kind of trying to stay at home as much as you can, going out for a walk is pretty low risk. But if you're quarantining, or especially if you're isolating because you're sick, yeah, you shouldn't go out.
And so folks are quarantining and they're isolating, but when should they get tested?
Yeah, so there are a few different scenarios. Certainly, if you think you're sick, then the most important thing to do is to get in touch with your doctor and get advice and to isolate at home, and to tell your family, hey, I'm sick. You guys should come home. We should all isolate. And then, if you think you're sick, getting tested can be helpful. It's not 100% necessary. And so we've had some people who say, okay, it's pretty obvious to me that I must have it. Like I have fevers, I lost my sense of smell, and I'm coughing. do I actually have to leave my isolation and go stand in the line to get tested? No, if you want to assume that you're positive and just isolate at home, that can be okay. And heaven forbid, if you need to come to the hospital, you certainly get a test then. So we have had some people isolate until they're better without getting tested. A lot of people want to know, like they want the test for that reason. And then there are some other scenarios, right? Like if you were in contact with somebody who turned out to be sick, then you certainly need to quarantine if you were exposed to them, like if you were in contact with them without masks or like without full kind of medical PPE. And in addition to quarantining for 2 weeks to see whether you develop symptoms, you may also want to get a test, or you may be asked by your employer or by somebody else to get a test. And in that case, it seems like the best time to get tested might not be right away after the exposure, but sort of halfway into your quarantine. Because if you're exposed on Monday and you get a test on Tuesday or Wednesday, you might not have any detectable virus in your nose yet. But if you give it a few days, it seems like often 5 to 7 days is the amount of time that it takes to go from a negative test to a detectable amount of virus. And then, I think this kind of explains a little bit why a negative test doesn't really replace quarantining. Like if you want to travel to see family, getting a negative test right before you get on the plane doesn't necessarily guarantee that you're not carrying coronavirus, because it can take a long time for it to reach that detectable level in your nose. And so the only way to know 100% that you don't have it is to quarantine for 2 weeks and not have contact with any other people. But sometimes a test can be helpful if you just don't have quite 2 weeks. And so, for example, there are some people who are doing kind of a hybrid thing, like, well, I can't quarantine perfectly for 2 weeks, but I can do it for about 8 days. And then maybe if I have a negative test at the end of the 8th day, then that's pretty reassuring. And I feel like I'm comfortable going and visiting my grandmother like that. So that's kind of an individual decision, and it's hard.
Yeah, it sounds like it gets pretty tricky.
Something else that I think is it's kind of the same idea, but worth explaining in a different way, is that the COVID test is really just like a point in time. So, if I go and get a COVID test right at this moment, all that tells me is whether there's a detectable amount of virus in my nose today. But if I were exposed to COVID, like at work last Friday, where I saw a bunch of patients, some of whom I thought might have had coronavirus, I wouldn't expect necessarily to have a positive test yet. It can take, I should say I wasn't exposed because I had all of my PPE, but I'm just using an example from my personal life. If I took care of a patient on Friday and for some reason I went into the room with no mask and no gown, I still wouldn't necessarily expect to have a positive test yet today, right? Because it can take a few days for that level to ramp up. And so if you get a negative test, but you have been around other people in the last few days, or you get a negative test, but then you go and get exposed to people right after, then, your negative test no longer means anything. So it really only refers to the day on which you get it. And that's why doing that 2-week quarantine is the only way to know for sure.
Right.
Yeah, and just to stress that point about the negative test, like even for people that come to the hospital, if people come to the hospital and their first test is negative, but we as the doctors are worried that they probably have coronavirus, we test you again a few days later because we know that that first test doesn't necessarily guarantee that you're never going to get sick. And just to explain the whole bit about levels and all a bit further, the way viruses work is if you just think of it like, let's say you get one virus, I'm near someone with coronavirus, they cough, I don't have a mask on, I breathe it in. I have one virus in my body. The way that virus is going to make me sick is that it's going to get into the other parts of my body and the cells of my body and make more of itself. And then once, let's say we get to about 1,000 viruses, just making a number up for explanation's sake, then I'll get sick. So if somebody coughed in my face and I have one virus in me and I got tested later today and there's only 5 viruses in me, I'm going to be negative because that number is still growing. But if I get a couple days and I cross that 1,000 viruses mark, then I'll be positive. So I hope that kind of explains a bit more how you can be negative one day, not really run into anybody else and become positive, because that virus's whole job is just to make more of itself. And that's how you get sick.
Right. Yeah. Yeah. Testing is definitely one of the more recent topics that I've been hearing buzzing around more as people are trying to understand this piece. So we appreciate these examples. Go ahead. Dr.
And this
Cooper.
reminds me of one other thing we should probably point out, which is that it can be frustrating to hear that it's possible to get a false negative test. And I think it's important to recognize, that the tests are pretty good. It is possible to get a false negative. It's usually because if your level is really, really low, like you've been exposed and you're technically infected, but you actually don't have a high enough level to detect yet, then your test might come out negative falsely. False positives don't really happen. And so I think it's important to take the testing with a little grain of salt in the sense that a negative test can only tell you so much. But I want people to know if you get a positive test, unfortunately, it's real. There's not really any reason to doubt a positive test. The test is pretty good in that respect.
Right. And the test is part of your toolkit, and your toolkit includes time, quarantining, right? So like still do get tested, as I'm hopefully I can summarize in a way that is helpful. Do get tested, because if you're positive, right? Like done. If you're negative, there's a few other puzzle pieces maybe to put together. You can at least have those pieces in your toolkit. You can have those pieces in front of you to try to be safer. If you have a negative test, again, I like that you included a 5 to 7 day kind of general recommendation to give an idea. I know not everyone will probably know exactly when they have had potential exposure, but something to keep in mind, right? And then just kind of seems like when in doubt, just try to stay put at least for the 2 weeks and just really dial things back as much as possible. Again, to the previous point about like, if you really do need to quarantine, isolate, like really no one's leaving, no one's coming to the house, right? In Lawrence, we are very fortunate to have a lot of programs put in place that, like groceries, for example, will be delivered to your door. So I just wanted to include that so people can maybe take or feel a little less pressure to still try to get some of the day-to-day pieces done on themselves, like have it be their responsibility, and say, you know what, when we say it takes a village, it takes a community to take care of each other. We're fortunate enough that in Lawrence we do have these pieces put in place. So something to keep in mind for folks, and can feel a little bit better about taking that step back for the 2 weeks, because I know it's tough, and I know work is a whole other consideration by itself. But yeah, thank you for those pieces.
Yeah, and that's a very good point you bring up, Sabrina, about just what we have in Lawrence that makes us able to do what we need to do to prevent this virus. I know in the beginning I said that, just by the population that we have, the jobs that we have, it makes it very hard to control this virus. But if there's anything about Lawrence, this is a very resilient community with a lot of tools at its disposal. I moved up here from the country in South Carolina, where we just really don't have a lot of community programs like that. And I was always impressed that here in Lawrence, we have things like We Are Lawrence and Groundworks that can connect people to resources they need to get through tough spots in life. And COVID is no different. We can get through this just like we've gotten through everything else.
Coming into the holidays, especially during Thanksgiving, we saw lines grow exponentially. What would you say to all these folks who are, getting out there and almost compulsively testing before the holidays? What would be your biggest advice to them?
That's a great question. I think that getting tested is a good idea. I don't want to discourage people from doing it, but I think it's important to know that if you have the ability to do like the best quarantine you can, even if it's a week and not 2 weeks, and then get tested once, that's better information than just going about your normal routine until Wednesday, getting a test on Thursday and getting on the plane on Friday. I don't want to discourage people from getting tested, but I also think if you have the ability to replace some of that testing with just good quarantining, it's more reliable.
So again, winter season is full of holidays. People are experiencing COVID fatigue. They want to see people, etc. But like, what are your tips for travel? Do you even recommend traveling?
At this point in time, I think the safest thing would be don't travel if you don't have to. I understand some of us may have to travel for work, or heaven forbid, there's like a family emergency or something. But if there's an alternative to not travel, just don't do it. A lot of that is because it's just really technically difficult to fully protect yourself. You're going to have to quarantine before you go, then quarantine when you get there, and then quarantine when you come back. And if you're quarantined for 2 weeks at a time, that's 6 weeks of just sitting in a room that we're talking about. And no one's got time for that. So really it's not worth it. And because we can't quarantine perfectly like we would love to, that leads us to potential exposure points. Like you may have quarantined, but then you get on a plane. And what if you got something from someone on the plane because that person that was on the plane with you didn't necessarily quarantine as well? Or what if you're driving, but then you decide to like sit at a restaurant in New Jersey that's like really closed and crowded, and you don't know what those other people have, because then you're just running that risk. And with a disease like coronavirus, you really want to decrease that risk as much as possible.
And what do you say to the folks who are convinced that they're young and they're not going to get sick?
So I think there are a few sides to this. I know that young people keep hearing, like, think of your older relatives, like, think of your abuela. You don't want to expose your older relatives. And that's true. It's also true that young people can get really sick. I have some young patients who were pretty sick and pretty miserable for about 4 or 5 weeks before they started to get better. And even now that they're better, I have some young patients who have complications, who aren't able to do all of the things that they used to do, even though, as far as I know, they were perfectly healthy before this. I have a friend who recovered, but she still doesn't have her sense of smell. It's been 6 months since she got sick. She was like one of the early ones. And I don't know if she'll get her sense of smell back. So really weird and bad things can happen to young people, unfortunately. That includes little children. And this is one of the really interesting things. In the beginning, the American Academy of Pediatrics was encouraging us to continue sending children to school and saying that it was uncommon for children to get sick. But as we get more experience with this thing, we learn that children can get sick, especially, unfortunately, Black and brown children can get sick. And that means a lot to us here in Lawrence. And children can get sick with somewhat weird symptoms. So like children with coronavirus might not necessarily have a fever or a cough, although they could. They could also just have diarrhea a couple times or have like a weird rash. And so it's easier to just keep everyone isolated and minimize the risk than to have all of this contact and then try to figure out, does my baby have coronavirus?
Yeah, no, that's really good pieces to note right there. Like, quote unquote, young and healthy people shouldn't be seeing COVID as, oh, if I get it, I get it. It'll just pass, right? Like the cold or flu and all this stuff, right? But like, it could be a lot worse than the cold and flu. And you're going to have these long-lasting effects that are these pretty solemn reminders for who knows how long to come. Yeah, so.
I mean, I'm a young, healthy doctor, and I do not want to get coronavirus if I can help it. It scares me, honestly. It's this unpredictable disease, and I don't want to run that risk with my own health and then find out I can't smell for the next year or ever, or that I'm just short of breath and can't run like I love to, or that my wife, who's totally healthy, she got it because of me, and then now she's never quite right again. So it's just something you really don't want to take risks with.
Yeah.
Right. And we understand that this has definitely been going on for a long time. And I know we're kind of compounding things a bit by limitations with the weather being colder or snowing and stuff like that. So like it's kind of the added reminder to stay home on top of the pandemic. But it really is what needs to be done, like being more careful, staying vigilant to protect, family, friends, neighbors, strangers. Like it's a respiratory disease, right? It's an invisible thing. No matter who you know and how much you trust them, like no one has control over this unless we just be as safe as possible, stay home as much as we can, right? Wearing the mask when we do have to go out, wash your hands frequently, use sanitizer if you have to, right? Like if you're out doing groceries or something. Um, but yeah, it's definitely a time to just be creative with our not in-person get-togethers, not visiting people's houses get-togethers, stuff like that as we get into the holidays, and figuring something out so that this can be temporary. It can be a temporary adjustment. So thank you both. If you have anything else to add, we are happy to hear it.
Stay strong. You talked about that COVID fatigue. We've been doing this since March, but we have news of vaccines coming soon, so we're almost to the finish line. Just keep doing what you do, control the things you can control, stay home, wear a mask.
Yeah, we'll get through this eventually.
Awesome. Well, thank you both.
Thank you so
really
much.
appreciate it. And we look forward to more conversations as things come along. Thank you both.
Definitely.
And stay well.
Thank you.
Stay safe. Stay well, you guys.